So for the second case, I considered several opportunities, but my goal here is to impress you. So I wanted to go for my recent one. I'm still testing this framework I will explain at the end. And because I believe it showcases my critical thinking and ability to evaluate opportunities. So this second case is going to demonstrate how we transform a data collection into cost-saving decisions for our clients. About the company, Lean Healthcare specializes in enhancing efficiency management, enabling data-driven decisions that optimize resource allocation. So the major customers are health insurance providers and companies that manage their own health plans. And traditionally, health insurance providers will only hear about the hospitalization twice. Once it starts, when the hospital make a formal request to admit you, and 60 days after it finish because they will send you the bill. It's weird, but it really happens. So the product LeanStay helped these insurance companies to collect actionable clinical data from day one. So we send our doctors, they use our internal platform to up all this information, and then our clients are allowed to have proactive decision making to improve the patient outcomes, so deciding for the health, and cost management as well, because if you don't, hospitals can spend as much as they can justify 60 days later. And while we were successfully collecting high value data, I discovered through a follow-up investigation, part of the process I'll explain at the end, that a key insight was being overlooked by our client, so preventing them from realizing tangible ROI. That was a specific client, but we noticed that could be happening with many others. So in this case, when a hospital sends a home care request for the patient, as you can see in the form, we capture this information and we start counting the days that the hospital waits for the answer from our client, that is the insurance provider. So for ICU patients, that means tens of thousands of reals just to stay in bed. And we, as a hired company that collect this information and show this to the internal team of the customer, we expect that they would use it for saving money, but that was not happening. So we were missing there an aha moment of our value proposition, what was critical for our product. So I proposed an experiment to the nursing team, our internal nursing team, that present the monthly report for the internal team of the client, aiming to shift this client from this passive data consumer behavior to a proactive decision maker with the potential to unlock at least 50,000 reals in monthly savings. For you to know, that is 3 to 4 days waiting for the approval of one single patient. And if you think that on average it's more than 4 days, and in average we have around 200 patients, it's very easy to reach this number. And our proposed approach aimed to enhance value perception in order to motivate the client to expand the hospital network coverage, that is the hospitals that he attends and that he have on his network and we can visit, in order to increase the delivered reports, that is our North Star metric aligned with our growth strategy and AI investment roadmap. And to achieve this, we structured our approach in a Plan, Do, Study, Act framework, widely adopted for product experiments. And here I summarized it in 3 steps: observation, experimentation, and results, so it can be quite objective. So what guides the experimentation is the hypothesis, and you will see it very structured, embedded in these 2 phases, observation and experimentation. And for general alignment, this extraction of hypotheses and experimentation comes from the scientific field, and we adapt them for product management, and typically follows this format that based on an insight, an information, a problem, an insight about something, we predict that a specific change that we will figure out will generate a positive impact that usually is the company's desired outcome. So we participated on this monthly presentation report of the nursing team, and we observed how insights were communicated to the customer. Very great, they were great, but in fact the insights were being consumed passively, even when they demonstrated the saving potential and even when they recommended certain initiatives. So after the observation, we evaluated collaboratively, and our hypothesis was that the lack of action is due to the failure to perceive value on our deliverables. So the way we present the listing of case, the counts, and the minimal estimates. And well, the first thing on the experiment would be test this guess that we have, but we knew that the customer hired us for tangible ROI, so the internal team, their internal team should be looking for it. And thinking about the changes that we could test, I started reviewing some frameworks, mental hooks, decision heuristics, in order to think how might we generate ROI initiatives, not only for this customer but for all, that would help us in the future have this conversion for expanding the hospital network. And I suggested to the team focus on creating urgency and let behavior economics principle drive action. In our first iteration, I proposed to change how saving data was being presented. So instead of generic estimate, we would display actual cumulative savings based on this unapproved home care cases. And all hypotheses need a goal, so our expectation was that the client would act on at least 20% of these flagged cases with in the following month. And once we did it, the result was that yes, the client found the insights interesting, but their behavior didn't change. So we needed a stronger approach to leverage urgency. And as in all tests, all iterations, we had an insight, we had a learning. And to be honest, it's very easy, exceeds this 50,000 reals per month. Due to this insight, for our second iteration, we shifted from showing monthly costs to showing the year-to-date accumulated savings that they could have, but they didn't. In creating with this a more impactful financial perspective. And to test our hypothesis, since it was in the beginning of the year, we decided to present the accumulated total of the last 6 months. And as you can imagine, it was a significant amount of thousands of euros. For this second iteration, we kept the goal of at least 20% of the cases they would ask us in the following month to act on it. But we were surprised that they requested 100% of the flagged cases in order to present for their internal team that take cares of home care requests and try to do something. So that's what we wanted. They shift entirely the engagement. So implementing data visualization really helped us to improve the value proposition. We made it on a lean format, so we had just a few hours to bring all this data, create the charts, and practice the presentation of them. And as you can see, the numbers on the left are related to each month, and the numbers on the right are related to this red line that shows the cumulative cost. So it's very easy to exceed this value. We had an immediate impact, But we also learned something, that is, our client don't have the autonomy to drive these initiatives that would let them have this ROI. But we changed the behavior, and they were interested on moving on this impact for themselves. Therefore, with this relatively positive result in hand, we will focus now on exploring how our team can support these internal initiatives for saving. So this way we can learn how we can expand the financial insights with predictive analytics, and then automate intervention in the future with recommendations based on financial data trends inside our product. One thing you might have noticed is that this experiment did not involve the user experience team. Actually, it was from a need from the nursing team, but it was related to our company goal. So this experimentation came from an approach that I started last month and I'm still testing, but it's something that comes from my experience with continuous discovery, root cause analysis, and Pareto analysis. I started to mix a little bit of these frameworks and mindsets and proposed a collaborative approach to map possible micro cause with the potential to trigger a specific and desired outcome. The idea is that when we start a quarter, we vote upon an outcome related to the OKRs, so part of our strategy to achieve them, and brainstorm possible micro causes that can move the company as a whole into this direction. So taking this example that we just analyzed on this case presentation, we have the company wanting to expand the network of hospitals as the strategy to increase the number of reports, so to make customers add more hospitals on our visit list. And the way we communicate the results, it's a major cause, considered for us a major cause for this outcome. So inside this major cause, we, with all the teams, separating different meetings, but explaining quickly here, we gather everyone, we brainstorm on what could be a micro cause inside this, communicating with the results that could drive network expansion. We had a list, and one of them was home care. And the idea of this framework is that, yes, if we have insights that one can be better than other, we'll vote and highlight this to the team. But the idea is that in our weekly goals for the product manager, product designer, sometimes the tech lead, and even the development team, we would take 1 to 3 micro causes and investigate them during the week and share the results in the end of the week. So we'll talk with other teams, gather data, make some tests in the code, even ask about on the weekly review interview that we have with the users on continuous discovery framework, or like we did here, making a lean experiment to figure out if that have the potential we imagine it have. So with this structured process in a fast-paced learning way, we can, with 2 people, easily test 30 possible drivers for an outcome on a month. And that's something that I didn't saw on the companies that I've been, and I thought it was very necessary in order to, we have so many ideas, so a lot of smart people in the team, so everyone have some ideas of what could help us to go faster on this outcome. And I'm still testing this framework, but it already shown a high potential to break down silos and drive user value. I'm really happy to say that I have other cases on my portfolio, and as I said before, for me it's important to bring different things, like, because probably you have seen a lot of wireframes and prototypes, but beside what I have in my portfolio, I have a design system case there, my industrial case with Mindsun as well. And I have another cases that if you want we can sit down and talk a little bit more. You can also find the results for each experience on LinkedIn, and there I listed also my key activities. You have some colleagues' feedback there, so user feedback is always good to understand about the service, and please feel free to connect. Thank you very much for your time.